A report by the Institute of Economic Affairs Kenya has revealed glaring gaps in the implementation of the Managed Equipment Services project in several counties. According to the IEA Kenya Programs Coordinator, John Mutua, whereas a section of the counties still face the challenge of undelivered machines, about 20 counties that receive the medical equipment are yet to utilize them. Safin Achieng Ouma now reports.
Speaking during the launch of a report on the assessment of the Managed Equipment Services project, commonly known as MES, Institute of Economic Affairs Kenya Programs Coordinator John Mutua revealed that equipments lie idle in about 20 counties which lack trained personnel to operate them, occasioning opportunity costs running into millions of shillings.
The fact that a needs assessment was undertaken, and yet we have cases where machines have been delivered but are not being applied or used, is an indicator, obviously, that the needs assessment exercise was not consultative, or it was not done comprehensively.
The project, which was initiated in 2015 by the Ministry of Health, entailed leasing of assorted medical equipment from 6 global companies to be used in various health facilities across the 47 counties for renal, laboratory, ICU, radiology and theatre for a period of 7 years. The report, however, raised questions over the unexplained variations in the cost.
The original estimated cost was 38 billion, which went up to 63 billion, maybe 3 years down the line. However, the total allocation by end of 2022 is about 42.5 billion. So you can see there are 3 different sets of amount.
And on whether an extension of the contract for a further 3 years is justifiable.
Remembering all the lessons and all the controversies that followed the first program, it's an essential thing to actually lay our hands on and ask ourselves once again, putting our fingers to the pulse and ask ourselves, so what's happening, what's going to change, what are the lessons and how are they going to inform the evolution policy, but more specifically, how health services will be delivered.
Despite the challenges, the Tharaka Nithi Governor, Muthomi Njuki, terms the MES project as a game changer in the health sector.
Equipment that used to be found only in Kenyatta National Hospital and Moi Teaching and Referral Hospital are now found in the farthest part of this country.
The governor has announced that he will be tabling a report on the impact and status of the project before the Council of Governors on Monday next week.
Where we have machines that were never placed on the ground, we can be able to tell the ministry, you cannot say that you are renewing a contract for a machine that has not been utilized.
Safin Achieng Ouma, Citizen TV.
The paramilitary rapid support force in